Well, in other news today, the numbers are out. They are not good. And no, we are not talking about COVID. The Cuyahoga County Medical Examiner's office released updated numbers of people who died of opioid overdoses in October.
Senior health correspondent Monica Robbins joining us now on the set of What's New to explain this very concerning shift in the opioid epidemic, which is only getting worse. What do the numbers paint here? What kind of picture are we looking at?
Well, right now, fatal cases relating to heroin and fentanyl in just the month of October are at least 35, and there are 14 cases still pending. Now, 17 of those cases were in the city of Cleveland. They were Cleveland residents. 16 were from the suburbs, 2 cases from out of the county, 1 in Akron and 1 in Jefferson. Now, the victims ranged in age from 23 to 76. 23 were male, 12 female, and while most were white, the death toll included 3 LatinX and 13 African Americans. This public health crisis has now spread from the suburbs to the inner city, and the rate of African American deaths involving fentanyl is 35% of all victims in 2022, a rate higher than all preceding years. As many as 29 cocaine-related deaths occurred in October 2022, with as many as 20 being mixed with fentanyl, heroin, or both.
First of all, every street drug out there now is being laced with fentanyl. I mean, all of them are being laced with fentanyl. And the other thing is that in the African-American community, there is still this stigma around entering treatment, seeking out for treatment, and even understanding that African-Americans use opiates at all.
Dr. Moore started a program called Brother, You're on My Mind, where her team goes into African-American communities to talk to them about what's in the street drug supply and why it's so dangerous. She explains that the drugs everyone thought were clean are now laced with fentanyl, which creates addiction, boosts demands for those drug dealers. And she also explains the importance of treatment, that addiction is an illness and there are resources available to help. Dr. Moore says she's watched this trend rise in the African-American community since 2020. And so far this year in Cuyahoga County, 629 people died from drug overdose. 464 of those involved heroin, fentanyl, and cocaine. And we are on track to match last year's rate of 675. Our deadliest year was 2017 at 727 deaths. And we were going down before the pandemic hit.
Yeah.
And then it just started to spike back up. So is there any hope? I mean, there's so many people that have to overcome addiction.
Yeah, you know what? Right now, there is a vaccine being studied that may be able to fight fentanyl addiction by blocking the drug's ability to enter the brain and cause a high. It's currently in clinical trials. We're crossing our fingers and watching that one.
Yeah, we're really hoping. It's amazing. It's more than 1 a day in our county.
Yeah.
And I've said this before on the show, but every day in the United States, more than 300 people are dying from fentanyl. That's the equivalent of a major airplane going down and everybody on board dying every single day.
Yeah.
It's alarming.
Yeah, it really
Okay,
is.
let's switch gears and let's talk about monkeypox. We haven't heard a lot about that recently. Has it gone away? Has it gotten better?
Unfortunately, no, it has not gone away. And Cleveland just reported its first fatality. The man had other health problems. He was hospitalized at the time of his death. But so far, Ohio has had 370 cases of monkeypox, 154 of those from Cuyahoga County, including 91 from just Cleveland. Please, if you need the vaccine, check out your Board of Health website. Find vaccine clinics near you. You can get the monkeypox and flu at the same time.
All right.
Right.
Thanks, Monica.
Sure.
So much information coming out at once, certainly.